Thank you. Are we switching this slide to on air?
Yeah, we're on air. Can you switch it?
We are on.
Yeah, we're changing the world.
Okay.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum, and this is Back at It with Dr. Decompression.
Welcome. This is the Back at It with Dr. Decompression podcast. Today, we have another guest that's been here before, Dr. Jahangiri of San Diego Chiropractic Neurology. Today, him and I are going to talk about clinical information. So what we discuss on a weekly basis about tables, decompression, how to make that one shift to get a patient the results and avoid spinal surgery. I want to thank our sponsors, PillowWise USA and PowerPlate USA for bringing this episode. Dr. Jahangiri, let's go. So, my case today to discuss, we talked about it. It's the cranial extrusion L5, 1 centimeter bulge. She can't walk, she can't sit, wakes up 6-7 times a night. And we talked about, I've seen this before when it's an extrusion and it's cranial to the head. For the listeners, I'll have to really flex the angle L1, L2.
Mm-hmm.
So we talked about that patient. Since we talked a few days ago, I had another patient come in with a 7 millimeter extrusion. And remember we talked, hey, have you seen an extrusion that's not cranial, it's caudal towards the sacrum?
Right. Yeah.
I see it rare, but I see it.
Yeah.
Dude, I saw a 7 millimeter. It's extruded. It's cranial and caudal. It's both.
So it's like a mushroom top.
It's a mushroom. Yeah.
Yeah.
So I did a few treatments with the cranial setup where it's L1, L2. We're really angling, right? We're really angling to get that pull and sleeping a little better. So not waking up 7 times a night, but waking up 2 times. So better, but still can't stand, can't walk. Been a few sessions. So instead, I kind of split the difference. I went L3, L4 because on the testing, she had less numbness and tingling in the foot.
Mm-hmm.
2 sessions, the pain in her ankle now is retracing back to her knee.
Okay.
2 sessions.
That's awesome.
Amazing, but I was shocked because I was like, wait, it's a mushroom, like you said, it's cranial and caudal, and so I'm splitting the difference to go more not as flexed.
Yeah, it just kind of goes to show you how you have to pivot based on case by case. It's never like not everybody fits into the same protocol, but historically, that usually works for you. You had to just tilt it a little different, leverage or create a different fulcrum. Try to get that mushroom cap back in.
How do you communicate that to patients?
I like giving them the visual. So I show them the MRI and, I'll let them know like, hey, standard disc bulge is just going to push straight back, but yours has actually moved into that, spinal cord space or like that, it's moved into the thecal sac region and all that. So yeah, just giving them a visual usually helps. I think I was telling you, I ran into a similar case and this is actually a 2.2 centimeter bulge.
Yeah.
And he came in with a full-on foot drop, right? So his foot's flopped down. It was his left foot. He couldn't pick it up. He was hobbling in. He was basically like jumping on one leg to get in. He could still hold weight on the leg, but he had really poor balance, super shaky, and he just couldn't lift that foot. He was like basically dragging it on the ground. It was kind of crazy to see. And sure enough, like I said, that extrusion or that it was going cranial, like you had mentioned, most of those go and went that thing slid back and up near the cord and was pushing on it, and that's what was giving him his foot drop.
Where was the disc?
And the disc was 405.
4-5?
Yep, 4-5. So that's why I actually gave you the foot drop as opposed to somebody that couldn't push off the ground. So if it was lower, one disc lower, I probably would have made it so he couldn't stand on his tippy toes, right?
That's a good clinical pearl.
Yeah. So he's got that, and we do a little pain relief treatment, which we do with everybody in the beginning. And this is the only reason why I still had him go get a surgical consult just in case, just to cover our bases. Because anytime you got muscle weakness, that's like a big siren that's going off. Like you need to get on top of this because we lose muscle fast and sometimes we don't get it back. Right.
What size do you refer for is it a size thing? Is it a muscle weakness? Is it both? Like at what size, like, dang, that's really big, I got to refer?
It's usually more, and this is what so sometimes it's size, but a lot of cases what I see with the surgeons don't do anything until there's like symptoms typically that are severe.
Got it.
So that'll move them. And the size can be super mild, but if they're experiencing dramatic symptoms, they're going to go in and try to do something.
Makes
basically,
sense. Yeah.
So I'm sure you've seen that too.
It's the whole picture.
Yeah. So we do that pain relief treatment there. We did the ARP wave. I think, we've talked about it, the electrical stim, and it improved that foot drop by like 20% just in that visit. One visit, I was like, oh, okay, this is a good sign. This is a good
That's really positive,
right?
Yeah.
Yeah. And then we challenged it, did the pull test, and that helped too. I was like, okay, we're gonna be able to do some cool stuff here. So anyways, we walk him through treatment. It's been 2-3 months and it's 2.2 centimeters. So it's a big
That's
extrusion.
huge.
Right. And he's gotten 80% better. So now that foot drop is dramatically reduced. He's able to move his foot around. Now he's in PT and he's doing the decompression at the same time. And we're kind of plateauing. And you had mentioned, hey, maybe we need to change the angle because we have him at a little bit of a more shallow angle.
What do you have
right?
him?
He's sitting at like L4, L5.
That's the angle that you're doing?
Yeah. And that was what, initially when we were testing, he was super acute, like couldn't sleep,
hard to
couldn't
figure
do
out.
any activities, everything hurt no matter what position he was in,
Yeah.
right? But when we tilted him at that angle, that's when the symptoms calmed down a decent amount. So I was like, okay, that's where we're going to start.
Makes sense.
But now we're plateauing. And I need to figure out, so we were able to get that extrusion down to like a 1.8. I need to figure out how to get it the rest of the way. Right. 20% improvement.
20%?
Pretty big deal, right? He's not going to get that anywhere else, but I want to get the rest. I want to try to really pull that thing back into position and make sure we're not, an accident waiting to happen type of thing, down the road.
Now, how much further do you think you can go?
Time will tell,
Yeah.
but I think we've already probably gotten more done because that image was done like in December and it's been a month and a half since then.
Okay.
And he's gotten more improvements. Like he's gotten additional, like when we took that image, he was at 70%. Now he's at 80%. So I would expect that extrusion has actually already gotten smaller.
Yeah.
So we're going to change the angle based off your recommendations, try to go maybe at a more extreme fulcrum to try to pull that extrusion back in.
When you go down, if you change the angle like from 4.5 to 1.2, you test it, it seems right. Do you change the weight at all? Or do you stay like, how much weight are you pulling with?
Right now we're pulling at like 100 pounds. So we'll back off. That's pretty big.
That's great.
We don't do that with everybody.
Yeah.
Right. But he doesn't have any soreness or any adverse reactions to it. So if we shift the angle, I'm gonna dial it back.
What will you dial it to?
I'm gonna go back down to like 50, 60 pounds. We'll start there and then we'll work our way up every visit and make sure he has therapeutic response. I want to see results each time we do it.
What are the specific results you're looking for? Because he's walking really well. He's 80% better.
I want to see him be able to balance on one leg.
Got it.
He's already doing that, but I want to see him like locked in. Because when he's on his right leg, solid, good to go. And when I watch him walk, he'll still list to the left just a little bit. When he's solid, he's just gonna be walking straight.
And that's what's important, is to find exactly, as we've talked about, like what exactly are we looking for? Like what's not just, oh, I feel 80%, or like the functional thing you're looking for, and that's how you can tell if the disc is reabsorbing.
And once we get to that point, then I know it's like, go full on with your PT, because he's still, careful about some of the stuff he does with his PT because it could potentially flare things up. He's worried about it. So it's still in the back of his head. But if we can get that locked in, dial that angle in, I think he's going to have 100% confidence. So
Wow.
that's where I want him. And this guy has not, like, he hadn't worked out in 10 years because his back was bugging him. Like, he had avoided exercise and actually changed because he's a business owner. He's got multiple businesses, and he stopped being out on the field because he does a lot of like remodeling and stuff and contract work for houses. He stopped doing all that and was just managing people at a certain point because his back pain was dictating how he was living.
For
Like,
10
he had to
years.
stop exercise, had to switch the sleeping position, had to wear a brace more often, had to, you know, completely change his type of work.
Wow.
So, and now he actually exercised for the first time
That's so
in
cool.
like 10 years, which is wild.
It's amazing how long someone can suffer like that.
Yeah, I mean, most will learn to live with it, right?
You adapt your
They'll
life
think,
to it.
hey, this is my new normal, and
Yeah.
then they'll just try to put it on the back burner. But the problem with that, as we both know, it's like they're going to get wear and tear. It's not making anything go away because you're ignoring it,
Yeah.
right? It's still there screaming at you. You're just trying to dial down the volume on it every day.
Turn down the volume a little bit.
Yeah.
Yeah.
They just want to hit the mute.
Yep.
So
That's awesome.
but,
So when will
yeah.
you do a follow-up MRI? What's the plan for the follow-up?
So we're gonna run with this new angle that you recommended for probably about 6 weeks, I would think, and then we'll reshoot. Yeah, and I'm gonna be checking his balance and checking his gait and all that stuff, making sure we're making gains with it. We also added in the tib bar, right? I think I
You
mentioned
did that.
to
You talked about that. Tell us what that
So
is.
he's gonna be using the tib bar. It's gonna allow us to do isometric. So the muscle that got injured, or the one that's like creating the foot drop,
Okay.
as a
muscle is that?
consequence of that, it's the anterior tibialis
Okay. Anterior tibialis.
that helps us pull that foot up towards us. And the tib bar is a really cool device because you can add weight to it, and then it'll just specifically hit those anterior tibialis muscles.
Are you
Yeah,
doing isometric or are you doing, what are you doing?
100% doing isometric because the isometric is going to create the most robust brain to body signal.
Okay.
And that's part of what he needs, because
That's
when
cool.
you don't use that muscle for an extended period of time, your brain forgets how to use it. Like, it starts losing the connection a bit.
What happens if the patient just does, I'm asking, I'm just curious with your neurology, what if they do repetition versus an isometric hold?
Repetition is still going to be effective. It's just not going to be anywhere near. It's going to be, let's just say, like half the potential.
It's not harmful, it's just not as good.
No, it's not harm.
Yeah.
Well, it's not harmful, but you do have to be mindful, just like with the isometric, of like not pushing past, like overtraining. There's still overtraining with this stuff. It's a muscle that you're trying to get to grow back, and it hasn't been, used the way it was. So yeah, you got to be mindful.
That's
But
cool.
it's gonna be cool, man. Yeah, I'm very confident that we switch this angle. It's gonna get him over that hump. He's gonna be able to like full on workout. He wants to box again, like just be able to hit the bag and stuff and go like running. Like, he's gonna do it for sure. We're gonna get him there.
It's so crazy that these tables are like, you're going to change his angle from 4.5 to 3 to 1.2.
Mhm.
And that is 5 degrees. No, 7.5 degrees.
Yeah. Yeah, you're just going from like, like here to like there, right?
Seven and
And
a half.
it can be all the difference, right?
It's crazy.
It doesn't need to be a lot, it just needs to be the right amount.
Yeah.
That's it.
Very cool. I hope
Yeah.
that tip helps. I'm sure it will.
Yeah, I'm looking forward to it. I'll definitely give you the update as we move along
On
with
these new
this. Yeah,
clinical pearls.
he's gonna do it, man. I'm excited for him.
That's awesome.
Yeah.
Gosh. Will you sign us off?
Awesome. Yeah,
Will you sign
no,
us off?
this is great. First little clinical session. I'm looking forward to more in the future, and we hope that everybody got a lot of good information from this. And let us know if you have any questions or comments that you want us to focus on, certain situations or things that you might be dealing with, and we'll try to correlate that with some of our cases so that you get some real clinical gems.
I like that. Well said.
That wraps up episode 16. Thank you to Dr. Jahangiri. And hey, thanks to our sponsors, Pillowise USA and Power Plate USA for bringing this episode. If you don't, make sure you subscribe to our podcast and our YouTube channel, Back at It with Dr. Decompression. If you have any questions or want us to talk about next topics, email me at info@drjdudum.com, or you can subscribe and then get us through our YouTube channel. Looking forward to episode 17 next week. We're bringing in a special patient who's gone through the decompression program in studio. We're going to have a fun time talking about his struggles with back pain, how we overcame it with spinal decompression, and his personal experience with our office. So make sure you subscribe. Thanks for watching. We'll catch you next time.